come on in.
Washing my hands. Hi, Mr. Hoffman. I'm Nancy. I'm a nurse from Harper College. How are you?
Doing very well, thank you.
Good. I'm here today to do a neurological assessment.
Okay,
And I'm going to start out the assessment by asking you 2 questions.
yes.
Have you ever had a stroke?
No,
Okay, good. And do you have any other problems with your coordination or with your brain that you're aware of?
no,
Ever have meningitis or MS?
no.
All right, good. Okay, that's good to know. So as we do this, I'm going to start by checking all of your cranial nerves, and then we're going to check your coordination, and then we're going to check sensation, and then at the end we're going to do some deep tendon reflexes.
Okay,
So we'll start out by just talking with you, and we're doing what's called a mental status assessment.
okay,
So I'm first off noticing your behavior, you're awake and alert and cooperative and responding well. And then I'm also noticing your cognition. So I'm going to ask you some kind of silly questions.
okay.
So can you tell me what month it is?
This is the month of August.
Okay, that's correct. And can you tell me who your favorite president is?
He's dead, but it was President Ronald Reagan.
Now I happen to know the answer to this question, so I know that's correct, but who's the current president?
Ooh, that's a tough one. Obama.
Obama is the current president, exactly. And can you tell me who I am?
Yes, Nancy Haberrichter.
Okay, good. So he is oriented to person, place, and time. And tell me why you're here today.
Well, I'm here today to be checked out, and we're doing videos for the assessment courses at Harper.
Okay, so and he's also aware of the situation. So he's oriented times 4, person, place, time, and situation. And I am also noticing that his dress is appropriate, his affect is appropriate, his facial expression is all appropriate for the situation. I also need to screen him for depression and suicidal thoughts. This is a screening that's done at every healthcare encounter today. It's required by the state of Illinois because suicide is causes a high rate of death here in our state. So, sir, have you ever been so blue that you felt like hurting yourself?
No,
Have you felt depressed or unhappy lately over the
No.
past 2 weeks? Like
No.
normal activities are not fun?
no, I've been having fun.
Okay, all right, so at that point I can stop my assessment. If he answered yes to any of those questions, then I would probe further with more questions about that. So, but he answered no for the first screening, and then we're done with that. All right, so we're going to move on for the cranial nerves, and we're going to start with cranial nerve number 2, and that is to your visual acuity. So we checked your visual acuity today, and we would check it for this assessment as well using the Snell and our eye chart. Standing 20 feet away, we would check both your right and your left eye, and your vision was 20/25 in both eyes. And continuing on with cranial nerve number 2, we would do a confrontation test. Can you stand up? And using this card, can you place this over your left eye? And then I will place this over my eye, and tell me when you see my fingers.
I see them. Yes. Yes. Yes.
Okay, and then switch. Look straight at me and tell me when you see my fingers.
Yes. 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 Yes.
Okay, good. So your peripheral vision is intact. That's cranial nerve number 2. Have a seat. Now we're going to check cranial nerves number 3, 4, and 6. Can you take your glasses off? You can just hold on to me for a second. And I want you to follow this pen in the 6 cardinal positions of gaze, keeping your head straight. And I see conjugate movement of both eyes together in the 6 cardinal positions of gaze. All right, and just follow this. I'm going to bring it in towards your nose. Good, and I see good accommodation. And then I'm going to look in your pupils. I'm going to shine a light in. And I see that the pupils, both of them, respond to light by constricting. And I would document that as PERLA. Pupils are equal, round, reactive to light and accommodation. That is cranial nerves number 3, 4, and 6. And then moving on to cranial nerve number 5. Cranial nerve number 5 is facial, where we are going to look at some movement of your face. So can you smile and frown and show your teeth like and I'm just going to check the muscles here, so grit your teeth. And I can feel those muscles get nice and tight, they're relaxed. And then also there is a sensory portion to this cranial nerve, so can you close your eyes? Tell me when you feel the cotton whiz. Say no.
No. No. No. No.
Wonderful. All right, you can open your eyes again. Moving on to cranial nerve numbers 6 we already did, so we're going to move on to cranial nerve number 7. And can you lift your eyebrows up and down, and then smile and frown, and then squint your eyes closed real tight, and then open them. All right, I'm looking for symmetry of the face. And remember, with this cranial nerve, damage is the Bell's palsy, where you would see drooping of one side of the face, or you might see that with a stroke. So that's cranial nerve number 7. Cranial nerve number 8 is the acoustic. I'm going to whisper something in your ear. I want you to repeat it.
Green wall. The Cubs are going to win.
All right, so his acoustic nerve is intact. You can put your glasses back on. So that was cranial nerve number 8. And then moving on for cranial nerve number 9 and 10. Can you open your mouth really wide and say, ah? Wonderful. And I see his uvula goes up and the soft palate goes up, and that indicates that cranial nerve number 9 and 10 is intact. And then cranial nerve number 11, can you turn against my hand? And turn against my hand, and shrug up against my hand. Good, and that is cranial nerve number 11 is intact. And then cranial nerve number 12, can you stick your tongue out? And the tongue should be in the midline, which it is. So now we're going to check muscle strength. So we'll start with the upper extremities. Can you please hold your hands out like this? And we would do that for a count of 10. And then can you squeeze my fingers? Squeeze as hard as you can. Squeeze really hard. Hard as you can. You're not going to hurt me. All right, good. Okay. So the reason that we check strength in this manner for a neurological assessment is that this arm lift is part of the NIH stroke scale that's used across the nation for our assessment of stroke. And doing the finger squeeze is an easy way to check assessment of strength of the upper extremities. If you give 2 fingers, the person can squeeze as hard as they want. They're not going to hurt you. If you give your whole hand or you give 3 fingers, you may come back with your fingers like that, which is usually not very pleasant. And then for the lower extremities, I'll have you lay back for a minute. This is an easy test to do. You probably want to lay back. And I want you to lift this leg up off the bed. And we do that for a count of 5. 1, 2, 3, 4, 5. Good. And then lift this one up again to a count of 5. 1, 2, 3, 4, 5. And relax. Again, that is part of the NIH stroke scale. That's why we use that method. And then if you could press down against my hands and pull up against my hands, that also tests strength of the lower extremities. Okay, so from there, we're going to do some tests of your coordination. So can you do this a finger? Touch each finger as quickly as you can. And then do it with the other hand. All right, good. And now touch your nose, and then touch my finger. Go as quickly as you can. All right, that's good. One caution while you're doing this is that when your client has their finger to the nose, okay, at that time you can move it, but don't, as they start for your finger, don't move it right at that time. All right, that's not a fair test then. So you can move it while the finger's there, but then hold still as soon as they start coming towards your finger. So we're gonna check coordination of the lower extremities too. So can you take your shin and your heel, just run it down your shin. And then do it on this other side. Just run it right straight down. All right. And then can you stand up for a moment? We're going to do the Romberg's test. Put your feet together and put your hands at your, stand up straight. Put your hands at your side. Put your hands at your side and close your eyes. And we would count to 20 seconds, and he should be able to maintain this standing straight and still without falling over. Make sure you're here just in case a person does start to lose balance so they don't get hurt. So 1, 10, 11, 20. Very good. You can open your eyes. And then can you walk a couple steps towards that outlet there? Just like about 3 or 4 steps, just normal. And then come back and walk heel to toe. Heel to toe, like this. You can relax your arms. There you go. Okay, good. Fantastic. So your coordination is intact. And then we're going to check the sensory system. So the first thing that we're going to do is check your sharp, dull discrimination. So you start this by having your eyes open and explaining this is sharp and this is dull. You can use a paper clip that you've opened up. You can also use a cotton swab to do this, whatever you're comfortable with. So close your eyes, and then you're going to tell me whether you feel sharp or dull. I'm going to do this all over.
Dull. Sharp. Dull. Sharp. 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 That was dull. Sharp.
Do not draw blood when you're doing this.
Sharp. 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 Dull. 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 Sharp. Dull.
All right, you can open your eyes. And then, again, we're going to check your light sensation. I'm just going to use a cotton ball, and I just want you to say now when you feel that.
Okay.
So close your eyes and say now when you feel a cotton ball.
Now. 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 Now.
All right, good. And then last thing, eyes closed, and hold out your hand and tell me what's in your hand. You can feel it with your hand. Tell me what's in your hand.
It's a coin.
Okay, good. You can open your eyes then. All right, so that's all for our testing of sensation. Now we're going to move on to the deep tendon reflexes. So I'm going to start this by having you just relax your arm up here. All right, I want you to be really, really relaxed for this to work. And you can talk to Amy over there.
Hi, Amy.
While you're
Hello.
doing this. I have, the way I'm going to do this is have him flex a little bit so I can find that tendon and then have him relax. You really have to be relaxed or this will not work. You also have to hold pressure on the tendon pretty firmly. You can see my thumb is on there pretty firm. Use the pointy part of the reflex hammer and you have to give it a good whack. And I could feel his tendon moving, but what
I
I'm
could too.
looking for is for his fingers to move, which I did not see. There we go, now we saw a little movement there. Okay, and then we would do the same thing on the other side. You put your arm up here. Again, I'm going to have him flex so that I can feel where that tendon is. I'm going to hold it pretty firmly. Now, I have very poor aim to do it with my other hand, but if you can hit your thumb with your left hand, that would be lovely. I'm not too good at that. Okay, so relax your hand. Talk to Amy over there.
Hello, Amy.
Hello.
Hold it firmly. Oops, I didn't do so well at that. And then what I'm looking for, there we go, is for those fingers to move. So that one tends to be a little bit stubborn sometimes. When you're trying to do that, it's important for the person to be relaxed. And then we're going to move on to the patellar reflex. Okay, so you're going to feel where that kneecap is, and then right below there is where you're going to hit, and you want the person to be really relaxed. When you hit, you don't want to hit like this. You want to hit loosely, like that when you hit it bounces off. All right, so you should be able to get a nice little kick from doing that, which doesn't seem to be working well with us. Are you relaxed?
Yes.
Are you sure? Oh, well, we got a little one there. Okay. There
There.
we go. Okay. And then
Try it one more
last-
time.
Try it one more time. Yeah, be careful that you don't get kicked in the face. Okay, lay back down for a second. That's okay. I'm gonna get my payback right now. Last thing is the Babinski reflex. So you're going to draw a J up the side of the foot and across the sole of the foot. Normal response for an adult is curling of the toes. So draw up the foot and across. So either no response or curling of the toes is normal. An abnormal response is a fanning out of the toes and flexion of the great toe. That would be an abnormal response. So a negative is normal, just like if you get an x-ray and it's negative, that's normal. So negative is the curling of the toes, okay, like that. A positive Babinski is bad, and that's the fanning and flexing of the toes. Okay, I think that we are done with our neurological assessment.